Have a few minutes before we get started. Oh, no, it's 11 a.m. And good morning to those of you who are in Eastern Standard Time. It's Saturday at 11 a.m. So I'm on a little bit earlier. And if anybody has any questions, please go ahead and put them in the chat box. But today we're going to be talking about a very important subject about fall prevention. And this is a major topic worldwide and concern, particularly for individuals who are becoming older. So I will start sharing some information about that. This is a continuing education course that I presented for about 10 years on balance enhancement and fall prevention. Yesterday we talked about balance. Today we're going to be talking about fall prevention because they're related, but they aren't exactly the same. So today, again, the topic is fall prevention. If you have any questions, go ahead and put them in the box. And I will go ahead and start getting started. So if you'd be so kind, just to let me know, can you hear me? And just go ahead and answer. And we're also streaming live on YouTube, so I'll be taking a look over there as well. Today's topic, again, is fall prevention. And again, big concern worldwide, particularly with individuals who are just beyond, above middle age. So I'm gonna go ahead and share my screen and get my presentation ready to go. All right, so again, today is part 4 or mini training number 4 of 14. And today's topic is fall prevention. I am DL Walker, for those of you who are not familiar with me, and most of you are, but I am by trade a physical therapist, licensed in the United States, and I have advanced degrees in exercise science, as well as fitness and cardiac rehabilitation. My website to find out more about myself and my programs is fixyouonline.com. And those of us joining on YouTube, I have a channel called Fix You Online TV and a Facebook group called Fix You Online. So if you would like to be in touch, any of those modalities, leave a comment, PM me, or go ahead and look at the website for contact information. And so I'll go ahead and get started here, and we're going to be talking about fall prevention. So here's some daunting facts. 24% of seniors will fall. That's an incredibly high number. So 1 in 4, almost 1 in 4 individuals who are seniors will fall at some point in time. And 58% of those people over the age of 60 will die within 1 year following injuries that are related to trips, slips, and falls. So again, pretty daunting fact. And one of the reasons why is because of the trauma that is caused by falling. So one of the reasons that I developed Correcticise for Life is to build resilience from injury and trauma or disease. So I'll tell a little story about myself. Last year, I was staying at a friend's house, and I was going to bed. It was dark, and I went down the stairs and did not realize that there was a turn that brought me to more stairs. So I literally tripped down 3 steps. I did not fall, and I did not break anything. And that was probably from a height of about 2.5 to 3 feet high, not expecting it. The reason that I attribute my my non-fall and my non-serious injury, don't get me wrong, I was bruised a little bit, and I did hurt my foot, but one of the things that I attributed to not a serious injury was all of the training and the work that I've done on my body over the last 25, 30 years. And again, it's the targeted things that are appropriate. So many of you know that I specialize in foot and ankle. So I'm constantly working on my feet. And again, I attribute my lack of injury to that work, as well as the fact that I did not fall, I was able to stay on my feet to the work that I've done from a body work standpoint, as well as, targeted Correcticise types of activities that I do in my daily life. So one of the reasons that there are so many fatalities is right here, the head. So many people, when they fall, particularly on their back, you have momentum causing you to slap your head back. This happens a lot also in car accidents, right? Whiplash. It's almost like a whiplash type of thing. You have nothing supporting your head. And if your muscles in your neck are not reactive and strong so that they can offset the forces that are acting on your body when you're falling, the head will go ahead and ricochet back. And this is very, very common with individuals who have what we call a forward head posture, because remember, alignment dictates function due to the length tension ratio, stating that muscles will contract with greatest strength when they're at a particular length. So with the forward head posture, individuals have some muscles that are too short, some muscles that are too long, and they will not work properly. This is why alignment is so important. And it is imperative that we restore the best alignment possible, or optimize alignment within every individual to keep them healthy, to prevent injury, and to build resilience. So very, very important. So let's define falling. It's defined as an uncontrolled displacement onto a surface or the floor that is below us. And it occurs, this will sound very familiar, when our center of gravity moves beyond our base of support, or our base of support moves beyond our center of gravity. So yesterday we talked about center of gravity and base of support. And just very quickly, our center of gravity is at sacral level 2. We'll get more into that. Our base of support typically in standing is our feet. And if the center of gravity moves beyond the base of support, that usually happens in a trip or a change in position, like reaching for something or turning. And this is why range of motion and disassociation between the different body parts from a musculoskeletal standpoint is so important. Then the other kind is when our base of support moves beyond our center of gravity. That's more with a slip. So that's when our feet fall out from underneath us. And that is oftentimes a result of a wet surface or ice or something environmental, that typically you need an external source for that second type of falling. You're much more likely to fall when your center of gravity moves beyond your base of support. And prevention is any action which in effect keeps something from happening, particularly something from happening that we don't want to. And if we don't do anything, the likelihood and lead a sedentary lifestyle, or even if we don't, and we don't target the appropriate systems that are involved with balance and take precautions on fall prevention, the likelihood is statistically that we will sustain a fall. But again, that's kind of no big deal as long as our body can withstand that trauma. So some of you know, I rollerblade and I ski. So those are two activities that are, that you can often fall, and I do. But another aspect of preventing injury from falling is to know how to fall. So when I was training as a volleyball player and then competing as a young adult, I learned how to fall in a way that would not hurt me. And so many programs, or some really good programs, teach people how to fall properly. And one of the most important things is to relax the body. And that is very difficult. But it is something that I do when I'm skiing. If I catch an edge, or if I'm rollerblading and I, go off balance, I do not panic. And that has been statistically shown to decrease the likelihood of injury. And again, that's something that can come with training And some fall prevention programs include that, the good ones include that with their training as well. So again, we're going back to center of gravity. It is at sacral level 2, about 4 centimeters below the belly button. It is affected by posture. And also this is why flexibility is so important. Because if I'm standing and I'm rotating to turn to get something, right, reaching, if I don't have good range of motion in my torso, what I'll do is I'll move my pelvis, because the body will do anything to achieve a task, right? Doesn't care how it's done. And if I lack flexibility in my rib cage, then I'm going to move my pelvis. My pelvis then houses my center of gravity. My center of gravity will go off. Same thing when you're bending forward, right? If you don't have good flexibility in your hamstrings, for example, and you're bending forward with a straight, with a straight back, what happens is our pelvis usually comes backward, right? That will again alter our center of gravity. So flexibility is so super important with regard to fall prevention. Same thing when turning the head. If you don't have good range of motion in your cervical spine, then what you're going to do is you're going to turn your body, and then if you don't have good range of motion, et cetera, et cetera, et cetera. So the ability to have good flexibility or ability to move independently each segment is super important. And again, that comes from specific release, not stretching. Mentioned this yesterday, lower center of gravity, the increased balance. That's why oftentimes individuals who lack balance will accommodate by squatting down and walking. So another thing to consider, you see somebody doing that, they are definitely lacking some good balance. The bases of support we talked about in an individual is typically our feet and also our shoes, the assistive devices and furniture. And then if we're standing on something, that would be a base of support as well. All things to consider. What we want is a stable base of support. We don't want a base of support that comes off the ground. So I worked with a tennis player. Okay, so here was an individual, mid-aged, probably early 60s, kept falling on the tennis court. And one time she fractured her hip, I think, and the second time it was her ankle. So I said to myself, well, why, what makes tennis different than, say, walking? And it had to do with lateral movement. And what that individual did when I tested her is as soon as she shifted over to one side, her foot would come off the ground. She would lose her base of support. So again, we need to move around our base of support, which is why I do an activity called foot clocks, which will go ahead and test your foot's ability to maintain position on the floor, not lose base of support as your body moves about it. So very, very important concept. What was interesting is, again, as soon as she weight shifted very, to one side, and again, common in tennis, her base of support would come off. So she was actually losing stability, and that's why she was falling. But the interesting fact is that her, the foot that was losing base of support was not the side that would be injured. It was the opposite side. And I treated her once, and she did not fall again that I'm aware of. So simple interventions can really make a huge difference. Okay, so there are these external risk factors to falling, and I just, many of you are aware of them, and I didn't include them in the lecture, but very quickly, just to let you know that 44% of falls are from the environment. So there are changes that you can make in your environment that will account for almost half of falls, but the majority of falls are within a person's body. And those are things that you can also change with the appropriate type of exercise. That's what I'm trying to stress with Correcticise, is that it's corrective exercises that correct certain problems and are performed correctly to be optimized so that you're not spending your entire day or wasting your time on something that you don't need to do. Because if you don't need to do it, you can still do it for enjoyment, but it's not going to help you. And that is because of something we talked about called specificity of training. If you want your vestibular system to get better, you need to do vestibular exercises. If you want your balance to get better, well, you need to figure out what is causing your balance to not be so great and address that particular area. Otherwise, if you're just doing general exercises, again, that's fine. They may help, but why spend time doing things that aren't necessary? Why not focus on the things that are? The second one is medication. So anyone taking 4 or more medications of any kind are at risk for falls. So you have to be very mindful of what you're taking, when you're taking it, and what you're taking it with. Okay, so some juices and those kinds of things are very important. Then nutrition, dehydration is a factor, and many individuals don't drink as much as, or don't hydrate as much as they need to, usually because they don't want to have to use the bathroom constantly. Then also vitamin D and calcium deficiency, which obviously vitamin D is important to everyone, and that's becoming more and more and more validated as time goes by, as well as calcium deficiencies, particularly in older women. Again, this is not new information. Then lack of exercise, but I would say lack of appropriate exercise, because walking might not help your balance. Just being active will not necessarily help your balance, especially if you have a vestibular problem. Vestibular exercises will then help your balance. If you have a dysfunction in your foot that is affecting your balance, well, you'd either need to correct the foot or correct your footwear, or possibly use an orthotic to improve your balance. Things like leg length discrepancy will affect balance as well. And then footwear. So typically thick-soled shoes that are poorly fit are no good. Barefoot is best because you're then getting stimulation to the receptors of the nervous system at the bottom of the feet. The more that you stimulate them, the better they're going to work. And I have one of my favorite exercises that I will go over tomorrow involves being barefoot and stimulating the bottom of the feet. And it is, I call it $1 million exercise because you get more bang for your buck. It addresses the sensory component. It addresses range of motion that I talked about within the foot. It addresses range of motion in the pelvis and the hip, really important. And it's all done in sitting. So awesome exercise. Medications. So again, you need to be aware of the medications that you're taking. Certainly the side effects, because many medications can affect muscle tone. They can affect the vestibular system. So there are always side effects with your medications, and be aware of them so that you can really make an informed decision about what you're taking, and speak to the professionals about that, who are the doctors and the pharmacists. And then obviously refrain from alcohol or any kind of sedative type of thing that can impair your balance and your reflexes. I often say, if you're going to drink a lot so that you relax when you fall. Because many people who've been impaired with regard to alcohol will be in horrible traumas, and they'll be just fine. Why? Because they relaxed. They were relaxed when the trauma occurred. So I heard a story about a man being in a tornado and thrown like 500 feet, and he was not hurt. He was asleep, and I think he was sedated. So again, that importance of being relaxed if you are in a fall or type of thing is super important. So you want to choose the best time to take medications and understand your interactions. I talked all about this. We talked about dietary factors with regard to vitamin D and calcium. So with some research, they showed that vitamin D improved functional performance, reaction time, and balance. and with calcium, decreased body sway. So again, controlling that center of gravity and increased musculoskeletal function in women. Remember, the musculoskeletal system houses those proprioception receptors in the muscle belly, the tendons, and the joints. So what can you do to prevent falling? Okay, remove environmental hazards. Remember, 44%. You might need to correct your footwear. Okay, so again, that's individual. That's something that should be discussed with a podorthist who is an expert in footwear, as well as education. So making environmental modifications. Again, those are typically, they are typically intuitive footwear choices. And then again, appropriate exercise, as well as vitamin D, calcium, and hydration, according to the research. So here's some factors that are affected, that are more likely to lead to falling. And what I found interesting is that all but 2 of these interventions can be all of these factors, with the exception of 2, can be altered with the appropriate intervention. So muscle weakness, we talked about that. That can be a result of the vestibular dysfunction, because we talked about it being contributory to muscle tone and development. It could be because we don't use it. When you don't use it, you lose it. It could be because of some sort of disease process or inactivity in particular. The great news about muscle weakness is that any human being at any age can improve their muscle strength. Anyone. Second is the history of falls. So if you've had one, you typically will have more than one, particularly if you don't take an intervention. Any kinds of gait, which is walking deficit. So if you don't have a good gait pattern, and again, a great gait pattern is one that keeps the center of gravity stable and always equidistant within our base of support. So the way that the body is designed, if it is moving properly, which it's not in 98% of people, is that there's movement at the pelvis, that on the right side and the left side, subtle movements that go with the leg that maintain that center of gravity in 100% stability. This is why gymnasts can do the balancing. Simple as that. But when they get older, right, the age that gymnasts start to decline is high teens. Mid-teens even, early 20s if they're lucky. The use of an assistive device. So that is obviously a risk factor because people are using an assistive device because they lack balance. The important thing too is to use the assistive device properly. Many people use a cane. I prefer 2 canes because it keeps the gait pattern more normalized. So, or walking sticks, great things to have with you because it also increases your base of support because you have 2 assistive devices touching the ground. Obviously, visual deficits, because we talked about how important the vision is to balance and orientation. So if our eyes are not working properly, it's not giving good input into our bodies with regard to hazards, with regard to where we are in space, as well as potentially not seeing something that we need to see as far as having peripheral vision. And again, guys, it's important to think about the base of support or what structures house the visual system. It's the cranium. So if you have a forward head posture, you actually are diminishing your peripheral vision. Again, alignment dictates function, frequency, and flow. That is, in my opinion, one of the most underrated tenets or facts with regard to healthcare. Then, of course, arthritis. We talked about for every cubic centimeter of inflammation, a muscle shuts down by 1%. The muscles that are closest to the joint are our core muscles. They are important for control. Control is important for for balance. And also arthritis can impair our gait pattern. Certainly when we're in pain, we're going to want to avoid doing anything that's painful or modify the way that we do something to make it less painful. So that is important, as well as, again, the proprioceptive receptors are within the joint. Any sort of inflammation is going to inhibit their ability to function as well. Impaired ADLs are activities of daily living. So things like walking, reaching, vacuuming, washing dishes, those kinds of things, bathing, are considered ADLs. And again, thinking about falls in the shower, again, probably because of deficits in range of motion. That's why so many people put in a handrail in the bathtub, but why not improve your balance and have the handrail just in case? Depression. So when we are depressed, we tend to be less active. And when we're less active and less social, we are not doing the things that we need to do in our lives to keep ourselves healthy and on target. Cognitive impairment. So again, things like dementia, which also, again, can be impacted by sensory deficits like hearing and vision. There's a direct relation to that, as well as a diminished vestibular function. After giving that presentation a few days ago, and if you didn't watch it, please do, I am now really gung-ho on the vestibular system and vestibular training, because it seems to me that improvements in the vestibular system can help with cognitive impairment, can help with improved balance, can improve with obviously fall prevention, can improve with even depression, coordination, and so many other factors that, again, people do not realize that their vestibular system is atrophying. And then here's an interesting fact. Over the age of 80, so they did a study actually where they showed that individuals between the ages of 79 and 80 showed a difference in their frequency of falls. And they believe that it has something to do with the myelinization or the fatty covering of nervous system, of nerve tissue. And so that seems to be the hypothesis for that. But knowing that if you are over 80, you are at an increased risk for falls just for being that age. And if you're getting close to that age, I strongly encourage you to take action right now to go ahead and train the systems that are going to be important to maintain balance and take the precautions necessary to decrease the likelihood of falls and decrease the likelihood of injury from falls. So super important to realize. So we have the intrinsic factors. So we talked yesterday about structure and anatomy, the musculoskeletal system. So you can refer to that. The neurological system, so we talked about that too yesterday, vision and vestibular. These are the things that we are important to balance. Sensory, again, that would include proprioception, vision, vestibular, psychological. So again, depression, as well as fear. So there's a study that showed that fear of falling leads to an increased risk of falls, because people will then avoid doing things that are challenging to their balance, because again, when you want to get better at something, you need to do that particular activity. So they will avoid that because they're fearful. Obviously, age we talked about, and then weakness with regard to the musculoskeletal system, its inability to react, possibly from inflammation, also the range of motion. So that would go back to structural or anatomical. And again, deficits in one can affect the other. And I always say that structure or alignment dictates function. So important. So we talk about the areas that are most important. So those are going to be the muscles that control the center of gravity. Those are going to be the lower abdominal and the pelvic muscles, the pelvic girdle. Oftentimes lack flexibility or mobility, important to release, then realign, and then reinforce independent movement so that the center of gravity is not swaying around when you're doing things like walking or bending or turning or those types of things. Then the structures that can improve the base of support. So the hip, the pelvis and the hip are important for the center of gravity, which we were kind of just talking about with regard to mobility as well as stability. And the same thing with the feet, keeping the sensory structures intact, understanding proprioception, and then also keeping the feet flexible, which is not available to the majority of people unless they've taken my courses on the foot and ankle, because there are over 50 joints in the foot that need to have good motion. They do not, because we are wearing shoes and we exist typically on flat terrain. So those joints, even from an early age, are not made mobile, and that contributes to many structural dysfunctions in the foot, as well as reasons for our feet to not be able to react as well as or be as mobile as they were designed to be had we not evolved in society. So again, the proprioceptive structures tell our body where it is in space. They are in the joints, the muscles, and the tendons. They can be damaged with surgery. They can be damaged with arthritis. They can be damaged with injury. And again, the more distal the structures, particularly in the feet, over the age of 80, decline after that age. The vestibular system we talked about, and again, huge component overlooked in the majority of balance enhancement and fall prevention trainings, and also injury prevention. There's much research now about the impact of the vestibular system and the proprioceptive structures with regard to injury prevention and certainly rehabilitation from an injury in athletes, and the vision. So here are some age changes. So muscles decrease about 12 to 14% per decade, beginning at age 50 for women and 60 for men. Is it disuse? Is it the vestibular system? Is it just age? You know, we don't know, but we know that muscle strength and muscle performance can certainly improve with training at any age, even over 100. With regard to osteoarthritis, then the joints, right? Because we talked about the proprioceptive system. The feet, decreased sensation, particularly diabetics. So again, very important to maintain stimulation to the foot. And if you cannot, there are intersoles that have been created to help with that, as well as the work that I teach, which helps with circulation, it helps with mobility, and those types of things. And then obviously there's a disease process called neuropathy that can be systemic. It also can be caused by a number of different things. So those are important to consider. So if you have one of those things, you have to be extra vigilant about keeping the feet in particular as healthy as possible, but then maybe doing a little bit of extra stuff with regard to the other parts of the body that contribute to improved balance and decrease of falls. So we talked about the sensory systems decreasing at middle age, and the significant difference in proprioception found in people over 80, particularly in the distal, which is furthest away from the center of the body, extremities, so the hands and the feet. So there are age-related disorders. So again, this is anything that affects sensory, neurological, musculoskeletal, or foot. Psychological strategies. So what you can do, again, know about depression, the fear of falling I mentioned, incorporate appropriate exercise and be compliant, which is the most important. And again, another reason why I created Correcticise, because they are appropriate exercises in the balance section that are targeted for balance. And you can be compliant with them because they are less than 15 minutes long. So you don't have to do an hour or go to a particular place to become involved. And again, going places can be great for some people and not so great for others. So we have places that exist that help with falling. We don't often have situations that exist where people can do this on their own in their home without specifically going to a rehab center. And usually when people finally address this, it's kind of after they've been injured. So why not take 10 minutes out of your day, or maybe even just 3 times a week, or incorporate activities in your day that will move yourself in a way that's going to be protective for these types of things. Because in my own situation, like I said, I've fallen a number of times, but I don't get hurt, probably because I have great mobility in my connective tissue, in my musculoskeletal system. I do activities that I enjoy, and I also move my body in a manner that is efficient and well controlled and balanced. Okay, so here's a single leg balance that are normal for age, but they're not ideal. Okay, so again, this is really testing our foot, the function of our foot. So seeing how long that you can stand on one foot, you have norms here for your ages, and look at how much it decreases between the age of 50 to over 60. It diminishes by half versus 20 to 49. I'm sorry, yeah, 20 to 49, and then 50 to 59. There's only a couple of seconds difference there, but then look from 50 to 60, it's cut in half, and then cut in half again by each decade, and cut even more in half between 80 and 89. So guys, this is reality, and depending on your age group, certainly anybody over the age of 50 and certainly over the age of 60 needs to be addressing the components of balance and fall prevention in order to maintain their health, vitality, and be resilient to disease processes that are going to affect balance, as well as things that will impact their falling. And again, there's so many things that are impactful within a number of different circumstances, both in our environment and then also intrinsically. So why not do the things that we can to take control and be able to address those particular areas that are important for balance? Okay, so we're talking about, now we're going to get into my favorite subject, which is the foot, because it's our base of support. And it is, in my opinion, the most important structure for fall prevention, probably in the body, and one of the most overlooked, because 84% people over the age of 65 have structural dysfunctions in their feet. I would say 100 people, 100% of every person. Again, it might just not be obvious to somebody who's not trained to look at it, but certainly with my training, I can see it in kids. And I do see it in kids. Alignment dictates function. If your foot is not aligned, meaning if it don't look right, it ain't. And if it cannot move at each individual joint in the 50, all 50 some odd, 52, I think, of them, then it is not going to be functioning ideally, and it can be changed. So increase chance of falling by twice as much if you're unable to perform a one-legged stand for 5 seconds, and a person must have 8 degrees of dorsiflexion with the knee extended. So dorsiflexion is bringing the foot toward the head or the lower leg. That's dorsiflexion. So important with regard to walking, squatting, and going up and down stairs, down in particular. So I say if I was going to make the world a better place, I would improve 2 ranges of motion. One would be dorsiflexion, the other is hip extension. So dorsiflexion, you need to have 8 degrees with the knee straight. Okay, so again, 0 degrees is neutral, okay, is a 90-degree angle, and 8 degrees is 8 degrees beyond that. Or 10 degrees with the knee flexed to be at a decreased risk of falls. That's more functional with regard to squatting and going downstairs. So again, same kinds of measurement, but the knee is now bent. The hallux, which is the big toe, should have 90 degrees of extension. That means coming up for a normal walking pattern. So again, if that is something that is lacking in you, then you need to go ahead and address it. So I'm going to go ahead and give you just a couple of activities to do on your own. One, take a look at your dorsiflexion. How much flexibility do you have to bring the whole foot, not just the toes? A lot of people compensate. It's the ankle okay? How much movement do you have with your legs straight? So you can just keep your foot straight right now and lift it off the ground and see how far it comes up. It should be about 8 degrees, all right? Then you could go ahead and squat down, and you need to be able to squat forward more than 10 degrees. So again, you can take a, you can take a look at what that looks like from a standpoint using a protractor, or you can look it up online. And then also see if you have 90 degrees of extension of the big toe. So you could either do that by going ahead up on the big toe and see if it can go up to 90 degrees, or you can passively take your toe and pull it back, and you should be able to achieve 90 degrees of range of motion. Lastly, you can go ahead and test your standing balance. You have the norms here, and see, hopefully everyone who's watching this is within normal limits. And if not, well, then you need to go ahead and address the foot, which will be my topic probably for next week. Tomorrow, I'm going to go through what we've done so far, go through some of the tests to test the various different systems so that you can do kind of a self-assessment, and then also give you that $1 million exercise that I was talking about for the foot. So I will go ahead and come back online. The balance test is with the eyes open, and those are actually just norms. So that's that is norm, again, is what's found in the majority of the population. That's not necessarily what's ideal. Okay, so again, the idea when you're talking about optimal single leg balance is how best you can maintain your center of gravity, right, which is at the sacrum, at the pelvis, over your base of support, which is your foot. So any kind of swaying, okay, is telling you something. Any kind of movement in your base of support is telling you something, okay? So again, you should be, right now, I'm completely on my left foot, standing. So I am really, I'm not swaying, I'm not moving. I am talking while I'm doing this, which is great, because again, the multitasking is an indication of the ability to do multiple things at once, like we do in the real world. So again, it's not just being able to stay on one foot, it's about the quality and how much control, because control is about balance. So again, if there's movement in the foot, there's a lot of shaking, quivering, and that kind of thing, that is not ideal. Okay, so stable, being stable and with control, okay? And it's interesting because I feel a very large difference between right foot and left foot, and many people will, okay? So for me, I need to work on my left foot a little bit more from probably a training standpoint. My alignment is pretty good. So again, you have to figure out not only where the problem is, but why it's happening in order to effectively treat it. And that's how I earned my reputation and became so effective as a PT, because I looked at the why behind the what and addressed the specific problems in an individual using certain factors, just like what I'm talking about, to determine not only where specifically the problem was, but more importantly, was it neurological, was it structural, how to go ahead and correct it appropriately. So I will just go ahead and check on YouTube and see if anybody's has any questions there, and go ahead, and if not, I will just go ahead and say goodbye for today, and look forward to seeing you tomorrow, same time, and let's see, same time, and we'll be talking about the tests that you can do for the vestibular system, for the components of balance, and then obviously you can look at some extrinsic factors. So I'll have some tests and guidelines for you for tomorrow, as well as the $1 million foot exercise that I love so much. All right, have a great weekend, everyone, and I will go ahead and talk to you tomorrow. Any comments, please feel free to reach out on the various different methods. Bye.